Hi, everybody. My name is Jacky Franco. I'm the co-chair and promotora for the East San Jose Peace Partnership, and also recently a board member for the nonprofit called Somos Mayfair. I don't know, Annie, if you want to introduce yourself before I go on.
Sure, thanks. I'm Annie Wu. I'm a program manager at the Violence Prevention Program at Santa Clara County Public Health Department. And public health, the Violence Prevention Program at Public Health is the backbone organization or the coordinating agency for the East San Jose Peace Partnership.
Okay, so the East San Jose Peace Partnership is located in San Jose, California. PEACE stands for Prevention Efforts Advance Community Equity. We are made up of residents, neighborhood associations, CBOs, business associations, and government organizations, all working together to build a healthy, peaceful, and empowered community in San Jose, specifically East San Jose, which we specifically chose 3 zip codes that are 95116, 95122, and 95127. They're shown there in the map for those who don't know San Jose. The goal of PEACE is to counteract the conditions that have led to high level of community violence and trauma in East San Jose by building on our strengths, community pride, diversity, creativity, and rich history of community activism. Our work includes addressing inter-partner violence through clinics and in the community, anti-displacement, and youth leadership building. And some of our founding members are in a protest for racial justice in the picture there, including some of our youth. Thank you, Annie. So just very briefly, PEACE is built on these core values. I'm not going to cover all of them because we want to, we have a lot to share, and I feel like PEACE has a lot of aspects that we can share about, but just to highlight a few of them, it's centered in community, so community first and community driven and led solutions with people who have lived experiences, residents, and grassroots organizations working on the ground. We also have a distributive leadership model, meaning that the public health serves as our backbone, but they don't hold all the power, but decision-making and leadership is spread across the network. And we're also using a racial and health equity lens, looking at who is disproportionately impacted, where there are disparities, and who is left out that needs to be brought in. And also centering around healing and trauma informed practices, especially as it relates to violence and violence prevention. Can you go to the next slide, Annie? And so here, some examples of the work that we're doing as it relates to the principles that we're sharing and learning about today. So our governance structure has resident co-chairs, such as myself, leading at all levels of collaborative and intentional engagement in the work that we're doing. So we have residents who sit on our finance and sustainability work group and make the decisions about what initiatives or what programs get funded. And we're also intentional about including people with lived experiences of the issue and not just token representation. And so if our work group is about anti-displacement, then looking for residents who have lived and experienced displacement. In our work groups for inter-partner violence, being also intentional but careful, as we don't want to cause more harm, but bringing in residents who really have lived and can share about what solutions they would like to see in our community. And also for shared understanding of structural racism and racial justice. Our visions and goals and our portfolio of interventions was developed through like extensive community consultation. So we started with like, I think it was, Annie, 13 initiatives or things that we wanted to tackle at once. And we just kept going back to the community, community spaces, surveys, and really narrowing it down to what we ended up with 5 work groups. And now this year, currently, we're focusing on youth, inter-partner violence, and anti-displacement. And racial equity centered root cause analysis conducted with each work group. And something that I want to share that I'm hearing a lot of and I think it's important, in 2018, very early on in the process of creating this partnership, there was trainings for members on structural racism. And this was for all entities involved, including community. It opened the floor that allowed residents to talk about their experiences, but also have really raw and honest conversations about why we don't trust government, as well as entities reciprocating that and acknowledging the harm that has been done historically and the trauma that, you know, we've had to experience. And so having those honest and raw conversations, at least for me, allowed me to believe in this work and this partnership and be open to working with these different type of government entities. Again, addressing past and current harm and prevent future harm. Peace is all about community-led solution and community power. And so something in the creation of peace that we really wanted to address was gun violence, because it was really big in our community. And we had a work group, but it was hard and a difficult decision, but we had to acknowledge that the members making up that work group, it didn't align with the values of peace. It wasn't community-led, it wasn't solutions that were coming from community. And so it was decided eventually to become a different entity outside of peace. And also we hosted a community dialogue after a police shooting and a healing session during a wave of anti-Asian violence. Holding space for community, even though it's not like initiative or somewhere where we're gonna produce numbers or we're gonna produce like outcomes, but just space to be with community, to heal with them, to hear what they're going through and what they're experiencing. And for procedural, structural, and distributional equity, all residents who attend our meeting are paid stipends or receive some compensation for attending meetings. Community and resident leaders make decision on our wellness grant. So we have a wellness grant wellness fund that grants initiatives, or even is accessible for other communities who have some type of program or some type of need, and they are able to apply. And the residents that sit on that work group share their input of whether or not we feel like it aligns with our work. I apologize, my children are in the other room. They're excited about this work so much that they're sharing their opinion.
No need to apologize for children being in the background. Love hearing their voices.
Thank you, Lisa. And also we provide language translation for all meeting materials, as well as live interpretation during our meetings, and childcare and snacks during all in-person meetings, which I really appreciate because I have my kids. But they're very well taken care of and they enjoy going to our sessions. And embedded measure and incentivize for urgency and accountability. We have analysis of how ARPA funding is distributed and its impact on pieces zip codes, as well as aligning public health data and epidemiology, sorry, I can't pronounce it, my Spanish is coming out, resources to support pieces work. Annie, you want to share on the public health department side?
Yeah, thank you so much, Jackie. Okay, just going back one slide. So like I said, public health is a backbone for peace, but in addition to coordinating peace, we also have a fairly robust and ever-evolving kind of set of strategies to work on racial justice and racial equity, within our own department, but also within the county. So more broadly, during the time of COVID, that's when I think public health really had the opportunity to really think deeply about how we're going to partner with community, how we're going to change the status quo. We were able to really contract with a range of community partners outside our traditional partners, because usually, the type of groups, organizations that are able to get government contracts have to be very, at a certain level, very, well established. But during COVID, we were able to receive a lot of liberties to be able to contract with more grassroots organizations. We contracted with Promotoras for them to roll out COVID services in their communities. We also developed the COVID testing and outreach educational strategies heavily based on the guidance that we received from the Promotoras, from community organizations, and from residents who are actually living in these communities most heavily impacted by COVID. In terms of shared understanding of structural racism in the face of resistance, in 2016, the Public Health Department adopted the Government Alliance on Race and Equity, GARE framework, and started to implement that framework. As part of that, we developed and launched a learning institute to train our internal staff, over 200 staff, on the core elements of racial equity, including structural racism, and just everything that's related to that framework. And we also hosted ongoing trainings for leadership as well as other staff from other agencies. And then jumping to number 4, procedural, structural, and distributional equity. So in 2015, Public Health Department identified advancing racial and health equity as a priority in our strategic plan. We also established a new office of the director and built infrastructure to advance racial and health equity within our department. And then in 2022, the county launched the budgeting equity tool to be used in public health budgeting processes. And then finally, around measures for accountability, racial and health equity is a focal point in all of our data measurements, population health surveillance, and health assessments. So things like around measuring COVID, chronic disease, violence, injury, we always use kind of a racial health equity lens to look at, you know, what the data tells us, but really breaking it down, disaggregating it, right, by race, by ethnicity, by income, by geography, to look at what's who are hidden in those large population samples that we really need to target our strategies toward. I don't, Lisa, Will, do we have time to go into this? I don't know where we are at.
Sure, if you want to just take a minute here.
Yeah. Jacky, do you want to talk about this slide?
Yeah, just stemming from these core values, Peace has developed these 5 pillars of strategy to guide our work. These are the ways we are getting at the root causes of violence. So a structure for community partnership, leadership, and self-determination, reduce rates of violence and trauma, increased healing, economic stability, resilience, and opportunity, stable, affordable, and healthy housing, and addressing immediate family and community needs. And I think our last slide is some pictures that we wanted to share, Annie. Just some of our partners and community spaces that we've held, Christmas drives, community focus groups,